My name is Stephanie Carter, and I am an Afro-Caribbean woman attending Howard University College of Medicine, and this is my elevated story. So when I was little, I actually really wanted to be a veterinarian. I loved animals from a very young age. Going to the zoo with my dad was my favorite pastime. And then as I got older, I kind of got stuck between, do I want to be a vet or do I want to be a doctor? And the reason why I was kind of at a crossroads of decision is because my mom's a nurse and she would take me to the clinics all the time with her. I would be in hospitals visiting family members and it didn't seem scary to me. And so growing up, I was struck between, do I want to care for animals or do I want to care for people? I knew I wanted to help at the end of the day, but the population, I wasn't sure. I'm like, should they have tails? Should they not have tails? It was a really tough decision. And so that's something that I really struggled with growing up, is trying to figure out what population I wanted to help. When I was a kid, I would always go to the hospitals with my mom and clinics with my mom, and being able to see the way she interacted with patients, she was always so patient. I feel like oftentimes people feel really rushed when they're in clinics because the doctor has to see so many patients. But my mom would always take the time to ask how they were, what they were going on in their life, if they had any confusion about what their next appointment schedule was like. And I always wanted to be someone like my mom in terms of the dedication, the patience, just the general bedside manner that she had. She always treated them like they were family. They weren't diagnoses on a clipboard that she was checking off. They were always family. And whenever I would go to visit my family members who were sick in the hospital, it was just really nice to have my mom with me because it can be really overwhelming and scary when you're in a hospital. Everyone's talking about WCs and HbA1cs, and you're like, there are so many acronyms and no one has explained them to me. I'm really scared. But having my mom with me, she would always take the time to explain what everything meant, how serious something was, if this was something that they could recover from, and being able to be there with my mom and we would pray with our family members together, I think like was a really big catalyst that pushed me into the field of medicine. I always knew I wanted to go to Howard. You can ask my mom. I told her, like, I'm going to Howard. Like, I've decided. She's like, oh, I think you should keep your options open. And I told her, no, I really want to go to Howard University College of Medicine. I want to go to a place where history was made, a place that constantly is striving to be better and to break more glass ceilings. Growing up and spending time with my mom in the hospital, spending time with my dad in the hospital, I never saw physicians who look like me. I saw nurses who look like me. I saw techs who look like me. And I would always ask my mom, like, why is it that there aren't people who look like me? And she always said something like, oh, maybe they didn't have enough opportunities. Maybe they couldn't afford it. Maybe they don't know about it. I remember telling them, like, that's not a good enough excuse. Like, we should be doing better. And I think that Howard has taken the initiative to make sure that they are not only producing the most African American physicians, but they're serving communities that need the most help. I think it's great that we have wonderful, competent physicians in all types of specialties, but if there's not all communities who are receiving access to that healthcare, what does it matter that you're producing competent physicians? And I think that Howard has done a beautiful job of intertwining both of those goals, producing diversity and inclusion, as well as serving the underserved. And you think about how many amazing physicians who have come out of Howard, Dr. Deborah Ford, Dr. LaFall Saul, like people who have really drastically changed the face of medicine. And I wanted to be a part of that history. I wanted to have mentors who understood where I come from, how difficult it was to be where I am today, who constantly were thinking about social determinants of health, not just the diagnosis, but what are the circumstances that created that patient's diagnosis. And it was the best decision I ever made. Like to be able to say that I'm part of the Howard family, to be a fellow Bison is, I can't think of anything better. When I got the email from ElevateMeD saying that I was accepted, I didn't believe it. I honestly didn't believe it. And I just remember sitting there thinking ElevateMeD is such an answered prayer, not even just for myself, but also for my family. And so I always kept thinking like, how am I going to afford all these research fellowships? Like, how am I going to be able to pay off my debt while also still trying to help my family from back home? And I remember reading that email probably after the 30th time, because it took me a while to actually believe it was reality. I just felt this weight just come off of my shoulders. And honestly, I tell people it was a miracle. And the reason why I say it was a miracle was because I had originally applied last year and I didn't get accepted. And I think it's one of those really important lessons that people don't always learn, is that delayed doesn't necessarily mean denied. And I think the fact that I got it after trying again was even more gratifying to know that I had grown in the past year, that my story still had an impact, and that what God spoke to me about what I was going to do and what my purpose and calling was, it was still going to happen, regardless of if the timeline had changed. And I think a lot of people get discouraged when they don't get what they want or the hopes and their dreams on the timeline that they plan. But delayed doesn't mean denied. And I'm just so honored that Elevate Med saw something in my journey and something that I said that really resonated with them. So I'm just so grateful and I'm so appreciative.